All right. Hello, everybody. Adam Bigelsen here, and we are here today to talk about something we're really excited about, something new for us. We're here with a holistic dentist, doctor. Do I call you doctor? Dr. Yoalli de Morey Novato. Yes.
I don't need the doctor because technically I'm not a doctor. I'm a dentist, a dental surgeon. And but yes, everybody is more used to calling us
Doctor.
dentist doctors, but
All right. To be respectful. Doctor, yes. Hola. Hola. So exciting. This has been fun. Since we met Yoali, she's learned about some new things and she's taken a cranial sacral course, which is awesome. As dental work can be traumatic, abrasive for our physical body, things like that. She's learning some new things. And she found out about dentosophy, which I had my sound effects. Yay. Something that's been around. It's been around for a while. Has it been around for a long time, or is this something newer?
a few decades, yeah, but not so um, mainly on the Europe, on that continent, on the other continent.
Sure.
And it's starting in this continent a little
Nice.
bit.
And I'm excited because you're one of the few people that are actually doing it in this on this continent now. Well, let's talk about this. So, dentosophy. What is dentosophy?
Dentosophy, the actual meaning of the word means the wisdom of teeth, which means that every tooth tells us something, and not only the teeth, but the whole mouth tells us so many things about the person. Dentosophy is not just the activator of the appliance. It's a combinations of techniques that the dentist trained on dentosophy we use to bring the patient to a balance, that the whole body is telling us the how to get there, to how what the body needs, because this is a self therapy that aid by the activator, which you show it. I have mine over here too. um, this activator is going to stimulate the bones of our skull and rehabilitate our involuntary functions, mainly the breathing, chewing, and swallowing. And these functions are the ones that develop the structure of our body. So when we are rehabilitating them, everything starts just falling into place and into a better and a more correct structure. Uh, so many things that can be going on.
Nice. Yeah, we talk so much about the structure as it's the supportive framework for our energetic flow. So many people having energy issues. It's the supportive framework for all that's going on. How many times we've seen blood and we look at the person that's got digestive issues, the structure's out of balance. But the question of how do we develop our structural patterns and habits? And we've talked about the mouth is the key to the temple, or the base of the temple, is what Dad used to say. So, what you're saying with dentosophy is you're working with the mouth, which is one thing, but it's connected with all else that's going on in the body. Awesome. All right. And this is new for dentists because, at least in the United States, they can't work beneath the neck. And we know what we've always talked about is the acupuncture meridians that run through teeth. And we know that the teeth are porous and they're connected energetically. So tell me a little more now about the connection with the mouth and the body. I mean, you showed us a video once of just the mouth breathing versus the nose breathing.
Nasal breathing, yeah.
Yes.
Well, the first thing and the most important thing to mention is that this is a self therapy. So this is a therapy that's accompanied by a dentist, but the patient and the body is the one doing the work and the everything that needs to be done. Um, and it's very important to mention it because the responsibility is the patient. And the patient's the one that has to put their will to do their work, the exercises, wearing it, using it, and doing the things that the therapy needs to see results, because everybody that uses it will have results. How much, what, in what way, it varies a lot because it depends 100% on the patient.
Nice.
We do work with the mouth, with the teeth, but since everything is connected, you can feel benefits not only on your teeth, but physically, emotionally, psychologically, cognitively, your posture, your mm, your memory, your how you rest, like resting better, sleeping better. There's so many things that are affected with or breathing, chewing, and swallowing, and it's beautiful how it works.
So this is totally different. This is not your typical dentistry at all.
No.
Not even close. So tell me then, I mean, it's very different. It's not even a comparison, really. You know, you guys work with the mouth is the only comparison with actual dentistry because you're really doing a lot more when you support the body holistically. That's awesome. So tell me
Right.
then, who is this for? You know, is this for people who do have dental issues? Is this for people who want to be better in general? Tell me your thoughts on that. Why would people search out dentosophy?
Well, everybody it's can be benefit from dentosophy, but it's not for everybody because not everybody is ready for the changes that are going to happen, because it's 100% it doesn't stay on the mouth. Everything starts changing. And a lot of people, it's not their time, and it's perfect. Everybody has their own path, their own time, and it's perfect. Um, because it requires this commitment. But everyone can be benefit from breathing better, chewing better, and swallowing better. It kids, they improve so fast and so beautiful that the usually the main use is with kids, but everybody, even patients without teeth that are using dentures, can use it to breathe better and reduce pain, reduce inflammation, start connecting a lot of neural pathways, and so many beautiful things that start happening. And the patients that start using the therapy, even if they're not consistent, they never want to actually quit it because they know and they feel that when they're doing the therapy, the dentosophy, they're feeling better. So they may go back and forth and leave it for a little bit, but then go back to it. But the more disciplined and the more consistent that the patient is, the faster and the better results we see.
Well, and let's talk about that too. You know, this is something we've always talked about with my dad and Josh and I, and you know this firsthand, is the person doing their homework. And I know this with you too, as I have my activator here and the homework. Oh, yes, the homework. We're doing the homework. It is neat though, you know, what you said to me as well. You put the work in, and that's when the results happen. So this is not about you, the dentist, fixing people.
Correct.
Okay. And then, so people that are interested, and there are people interested, people listening to this are interested. Commitment, though, it's a program. All right. You know, we're going to do this with you in February. People are going to come. It'll be fun. We'll look at blood. We'll do the Qigong by the lake. Um, you're going to do an intake with them. I assume there's an interview and there's pictures of the mouth or things like that you were doing, I remember initially. There's the initial appointment. People get an activator. They go home with exercises. Then they have to confer with you or check in with you periodically, but then they got to get back to you a few times, correct? So
Correct.
tell us a little bit about how that process works. What's the time commitment and things like that?
So it is a self-therapy, but it needs to be accompanied by a dentist because a lot of changes are going to start happening. And most of them, since we are starting in the mouth, you need someone that's been through the process and knows what you need to be done to explain what you're going through so you feel that you can continue, more comfortable to continue. The full treatment of dentosophy, it's about 18 months. These 18 months, we divide in 3 phases of 6 months each, the ideal treatment. And every 6 months, we work in an area or a quality of the soul. And how I've been working with my patients, since most of my patients are not from where I am. And in this case, we're going to do this retreat. That's going to be awesome. It's going to have way more things than just the visit to the dentist. I see them in person to do all the things that we need to do. And then I have to see the patient every 2 months to check in, to do a follow-up and see what's going on. And in those 4 or 3 appointments of those first 6 months, every 2 months, we can do them online because of the patients here that me and another dentist are the only ones here in America doing it. And before we go into the second stage, I need to see the patient again in person. So first of all, to check where we are and to see if the patient is ready to move into the second stage, or check if we need a little bit more time to do before we jump into the next stage, because there's things that need to happen before we change every phase. So those are the time. So it's an 18-month divided in 3 phases of 6 months each.
Mhm.
And I see the patient in person every 6 months. If we can extend it a little bit more, but that would be the ideal. And every 2 months, I see the patient for a follow-up.
Cool. Okay. So people can initially, as we're doing this retreat, people come to us. We work with you. Awesome. They get their new appliance. You've got information. They get to go back home to wherever they're at, and you'll get on with them a couple times. Then they got to get back to you.
Correct.
Right. So in the course of 18 months, they'll see you 3 times in person. That first time, 6 months later, and 6 months
If they
after
can
that.
do more, we can do more, but at least those 3 times.
Okay, cool. So, and this is more than teeth. This is a whole
Way
body,
more.
holistic, integrative experience. And I really, with the people that have listened to us and Dad, Josh and I, the body work, the structure is so important, and the mouth is part of the structure. We've always said osteopathy important and acupuncture, Chinese medicine important. At this point, up till this point, we've said just avoid your dentist. Do what you can to not have to go. But this is proactive. It can be preventative. In your mind, if kids are doing this, are they going to have to do things like braces, as time goes on? Are they going to have some of the issues? Maybe they can keep their wisdom teeth longer, even, and things like that too, or keep them.
Not longer, just keep
Keep
them.
them.
Well, it's very interesting what you're touching here. So keeping the dentist away is a very good thing. We shouldn't need the dentist, but since we do everything, we don't breathe properly, we don't chew properly, we don't swallow properly, a lot of things start happening, a lot of malfunctions, malocclusions start happening, and a lot of cavities and a lot of so many things that we have that we need to see the dentist. With dentosophy, you may not have any cavity and still be a very good thing to do because you are a mouth breather, because you have back pains, because there's so many reasons why you could be benefit from dentosophy, even if there's 0 cavities in your mouth. Um, but the most beautiful, which is a second thing that it does, because we're trying to get to a balance and health, but a side effect very great of it is that since we're stimulating the bones of the skull, the whole flow of our ritmo craniosacral
Yes, cranial sacral rhythm.
or craniosacral rhythm
Yeah.
starts flowing better. We start stimulating it, and we start stimulating the bones to expand and to get to where they actually, the body needs them to be, to a more correct structure. And since the body is doing it on its own or on its pace, at its own pace, the teeth start aligning like magic on its own. So there's very little need for braces. Since I do have to say that it's not 100% like we're going to give you straight teeth, but dentosophy helps from different techniques, not only the activator, that if you do need, we can use different types of appliances that we can help to finish the final touches if there's need to that. But sometimes just the activator works with it, because it's not only that you don't have space for it, it's also an emotional part of it, of that the tooth is the reason why the tooth is misaligned. So with dentosophy, we're not only working on the structure, we're also working without trying on the emotional part of it, and things start resolving, and the teeth start straightening.
That's awesome. It's so it's one thing for kids. So many people do end up with braces, and so many dentists take out wisdom teeth almost automatically. As we talk about this, the cranial flow and the suction that the mouth creates when you're swallowing and it's pumping cerebral spinal fluid. This is for kids all day. Like this is for us, Josh and I would say one of the best things you can do is get your child to an osteopath. All right. When they're young, they're very malleable at this point. This is the new thing I'm saying. Get your child to the dentosophist, dentosophy person. So that's great. It's helping set structure as children are developing. It's going to support that. It's going to support emotional flow. This is
Yeah.
really, I'm excited about this. Let me ask you this then too. This is really for everybody. It is.
When we have a joke that when we are with our mentors, they're like, we should be throwing the activators on the street when we're walking, because everybody needs, like 90% of the kids breathe through their mouth. And maybe 85% of them have their tongue on the bottom instead of where it should be on the top. Um, and the adults as well. We have so many dysfunctions in our breathing or chewing or swallowing. That's why we get so stressed, because the breathing is what helps our connections on our brain to come down, to tell it how we are so it can regulate itself. But if we're not telling it, then how is it supposed to know?
Right. This is our lives. Our lives are chaotic and crazy. So this helps to really settle the nervous system down. And so
Yeah.
many of us are under so much stress. So really still then, for this is for everybody. For kids best because they're going to develop that much more in a balanced way, which is
Yeah.
great. They could potentially avoid things like braces, which are not good for locking in the cranial mechanism. They can keep their wisdom teeth, which is just amazing. People don't do that at all these days anymore. Let me ask you this too then. If someone does have dental issues and they're looking to work with teeth, we look at the blood and a lot of times we see dental issues causing other problems. It's all connected. I would think that before going to a dentist, this would be a better place to start because the activator will then support structure, teeth will potentially move, and then the dentist is involved anyways. So tell me what your thoughts are on that.
Yes. If we don't have anything urgent, it's best to first do the dentosophy, because when you go to the dentist and you have an unbalanced bite, we dentists work on your unbalanced bite and we place the work on an unbalanced mouth. And we leave it like that because that's the way you chew and that's the way that you feel the best. But if there's nothing that needs to be removed or changed right away, we can start dentosophy at least 6 months. And after correcting and helping the body rehabilitate the functions, then we do the dental work that's needed. And you're gonna have so much better dental work, more pretty, more aligned, more aesthetic than what you would have had. Now, if a lot of patients come and they already have a lot of dental work done recently, crowns, bridges, and they want to do dentosophy, we can do it. And dentosophy, with the activator, we stimulating the bone and the bone moves and the teeth follow the bone. So with this, the work moves, and we have to just have in mind that sometimes we would, after the mouth has a balance, we might need to replace some of that work, or sometimes it just aligns and some adjustments are enough. But that's why a dentist is a trained dentist, dentosophist. It's important to have so they can follow that alignment and give you a balanced bite, a correct balanced bite.
Okay, that makes sense. And you did say, I don't remember if you said it tonight, but you said before that even people that have dentures can do this.
Correct. Because we're actually not working with teeth. That's a secondary effect. We're working with the bones and with the functions. And these functions are the ones that we are aiming to rehabilitate. And even if you don't have teeth, which a big reason why you lost the teeth is because you have all of these functions not right, and you're gonna see and feel benefits from it. And you can use it wearing your dentures, you can use it without the dentures, and gonna start having benefits from it because you're rehabilitating the function, which is what we're aiming to do with the dentosophy.
Nice. So to me, this is once again something everyone should do, everyone can do, regardless of where they're at, and it's going to only benefit them. You know, if the structure is supported, there's a better cranial flow. You get the little bit of the osteopathy involved. You've told me once it's like having a little osteopath in your mouth, the having the activator. So it's going to improve cognitive processes, the flow in general. All right. If we're breathing differently through the nose, that works with us structurally, supports our structure. So this is really, and even that you talked about the emotional support here. So this is totally aligned with what we've always talked about, you know, the four body experience, that we're more than just a physical experience. To have dentosophy not really be focused on the dental experience is kind of interesting. Let me ask you this then too. As I look through some of the notes, part of the commitment is reading the book.
I like my patients to read the book because they will have a better understanding of what we're doing, and a better understanding of the depths that it can help with. And knowing that, it gives them a better treatment. For some reason, for you, that information will help you work better on yourself. And another reason, that's the first thing that will let me know that you're really committed to do the treatment, because reading a book that can take you a few days, a few weeks to read, it's something to do. It's a commitment. It's putting the wheel on your part, and that will let me know that you are on that track. For kids, it's the parents' decision. So we as a dentist, we explain the kids a little bit of what is gonna be going on, but they have so beautiful, the results on kids, it's amazing. And they do better in school, they do better at home. They, it's just,
They listen better, they hear things differently, they're cognitively processed, they can be more grounded and centered potentially. Cool.
yes, because with our mouth is one of the first, um, it's not a barrier, but we interpret what's going on in our outside world through our mouth, or hands, or mouth, or feet, or eyes, or ears. So if we are breathing improperly and we are breathing through our mouth, all of those sensors that are supposed to interpret what's going on the outside are wrong to just call it something. So we are from starting from there, we are interpreting wrong the world, and everything starts shifting, and we respond because of that information that we have. So correcting that, we automatically start seeing the world different, and it starts changing our whole experience, especially for the kid. I mean, for everybody, but the kids, they started, since they don't question anything, they know that if my dad is giving me this is going to be good for me, and I do it, everything just starts flowing so fast for them. I think maybe in adults, the questioning could be a part of the break that we put in because of our doubts. But the doubts come from that mind process that's going on. I mean, Dentosophy has scientific answers for everything, but just just do it, and you're gonna see and you're gonna feel the difference, and there's no need for all the explanations, although they're there, just to know that it's working and that you feel better every time that you're doing it.
That's cool. It's knowing that I'm doing things that are good for my body is important without having to go down a rabbit hole of why. For me to understand a little bit, I'm good. We can then run with things and then see what starts to shift. So, yeah, it's a funny one. I'm excited. I think everyone should be doing it. I'm looking forward to the retreat myself. I have my
Yes,
activator. I've been
me
doing
too.
that. Reading the book is interesting too, because yes, are people ready? And as people are watching and listening, commitment. I want to be the best I can be. There is nothing more valuable than your health. And as far as money is concerned, there is nothing worth more or better to spend money on than your own self.
Mhm.
And people will spend more on their dog and their car than their own bodies, right? But this to me, I think this is a missing piece to our puzzle. If Dad was here, he would say, you got to understand homotoxicology, the patterns and progressions of disease. And then he'd say, get to the osteopath, physical body, energetic and emotional. Get to your Chinese medicine practitioner, it's energetic, emotional, and spiritual. And I think he'd probably say, get the damn activator when you're young so that you're not going to have to go to the dentist when you're older.
When you're older, yeah,
Really?
because just a quick something, that how we swallow and breathing through our nose is a big part of our oral health. Breathing through our nose makes our lips to be sealed, more production of saliva, more remineralization of our teeth, less inflammation, less bacteria, because the teeth have their proper microbiome, their proper structure that they should be, and everything starts being stimulated correctly. So everything starts flowing perfect.
And we can learn, we can change. I wonder how many
Yeah.
people listening to this now have their tongue on the roof of their mouth, which is where it's supposed to be. I've been doing that the whole time. Notice my mouth has been closed. I'm breathing through my nose. I think this is awesome. As humans, we have so much potential. We see these videos now of the kids that are reading without their eyes and things like that. What's our body capable of when we support it? We've seen crazy things go on when you support the body. This is for us, a new, simple, and awesome way to support your body holistically. Let me ask you this too, and then if there's anything else you think people need to know about this, I mean, come on, people, you want to think more clearly, right? Do you want to develop more efficiently? Do you want to have more structural alignment? When there's structural alignment, less pressure on the system. This is going to affect digestion. I mean, this is going to affect sleep, right?
It affects everything. Let me read you a little bit of what it
Go ahead.
affects because it's so much. Um, breathing properly, it can improve your cardiovascular health, brain function, memory and learning. It regulates stress. It calms the mind and anxiety. It puts you in a better mood. Um, it it increases the nerve, the vagus nerve.
Vegas, yes.
It reduces inflammation, it reduces pain, it promotes what I was telling you about the saliva, it keeps the mouth humid, it avoids dryness, the bad breath, and cavities. Um, we talked about the heart. It increases the oxygen, it reduces and high blood pressure, it improves your sleep, it fights against asthma and sinuses and pathogens. Just breathing through your nose. All of this is just breathing through your nose.
That's crazy. She said pathogens, people, don't be nice to her about that. No, I think
Pathogens.
I think it's awesome. It's another cool, simple piece to the puzzle that if we can incorporate this, some align the car, get your tune-ups and your oil changes, get to the Chinese medicine practitioner, get to the osteopath, get your joy, but get to the dentosophist. This is simple. It sounds very profound without question. And, we've seen this too. It's the little things, small changes in that biological system can affect the greater whole. So with this, there's a retraining that's going on, and I think it's crazy how much of an effect it can have on the body. So who wouldn't want to do this? Is there anyone this is not for? Uh, Sounds like everybody and anybody. If you're going through an acute dental thing, we can still talk to you about that. You can let us know whether, we need to take care of something first. If I got the big hole in my tooth, I should probably fill that in first, potentially, right? But is there is there any reason to not do this at any age? I mean, even if we're really older, in life, this can help with clarity of thought and those cognitive processes. Is there anyone you would ever say, no, this is not for you?
Mm, it can be because a patient can be very comfortable where they are, and we do not mess with that. If the patient feels like they can do more, they can do better, 100% for you. No matter if it's just that you feel like you're shy, that you feel like there's something inside you that tells you that you could be doing more, and you have that little something that tells you that it should be a little bit more to life. This is something that can help you thrive those tools that you have in you to bring to the world.
Nice. That's cool. Yes. And if you guys want to be the best you can be, this is one of those things you can do. And if you're happy with what's going on in your life and where you're at, you're probably not watching this video. Right?
Probably.
Yeah. Okay, cool. Well, good stuff, really, Yoalli. I'm excited. We're doing the retreat in February. We're going to share the landing page pretty quick soon. Is there anything else you want to tell people about this?
I mean, specifically about dentosophy, you have to try it. I mean, it's something that will, if it's talking to you, if you have that curiosidad,
Yeah, curiosity, yep.
it's calling you, and it might be your time to try this, and it's something that has to be experienced.
Nice,
Um,
nice.
it's a self-therapy, so you move on your own time to the body's pace, and you're the one fixing yourself. You're the one healing yourself, should be there.
That's awesome. I think it's great. So, simply enough, we're doing a Yoalli is you're one of two people, is that correct, in this
Correct.
continent now doing this, right? Okay. So we're excited. We're offering it to our people. Yay. Get in line. You guys are ready. People, we're going to come down for 5 days. We'll do blood and all the fun stuff that Anna and I usually do with talking about structure and energy and emotions and spirituality and the mind and consciousness. They get to do this work with you. They get to go home with an activator. They have to read a book. There's a commitment that you're going to chat with them every couple months, and then they got to get back to you
Correct.
in person. All right. It's a horrible thing to have to go to Puerto Vallarta to visit Yoalli, right? No pressure, but maybe I'll meet you there and get some tacos and we'll go surfing. So cool. I really am excited to share this with people. Kids, teenagers, adults, seniors, this is for everybody. It's going to help improve quality of life. No one's getting in there with the pliers and drills, you know. So, and what's neat, Yoali, if you guys are watching this, if nothing else, you can see how excited she is about this. All right. When was the last time your dentist was excited about something new in the dental world? So, this is new for you. You're thrilled. You're really ready to do this.
Yes, I'm really excited because the first step to become a dentosophist is to do the treatment yourself. And my life has changed. I was about to retire from dentistry at my 40s because it was just my back was hurting all the time. It wasn't actually giving me anything. And yes, it's noble to do a service and fix a pain and fix a tooth, but I wanted more for my life, and then Dentosophy is bringing that to me. So it's changed my life, and from that part, I can speak and say that it works.
That's so cool. And it's really, you know, for you guys listening, ask your dentist if they've ever heard of dentosophy. There are trainings and people can learn these
Yes,
things.
we
But first,
also need more dentosophist. So ask
yes,
about it so dentists start investigating about it and training on it.
nice. And come experience it so you can tell the whole world about it, right?
Yeah.
Cool. Well, good stuff, really, Yoali. I'm excited for this retreat. I'm always excited for retreats because I love getting together with people, you know, and with Anna and to use our tools with people in person and have them really go through the experience and take new practices home with them is awesome. But now to include this in that whole experience, I'm thrilled. I'm really excited. This first one we're going to do is not going to be the last one. All right. So with all that being said, as the motorcycle goes by, loud at the very end. With all that being said, for people listening, Yoali, what is your website? Just out of curiosity.
My biodentistry.com.
Yes,
I don't have
mybiodentistry.com.
anything about dentosophy there yet. I
I
haven't
was
updated it.
I was just gonna
But
say
that's
there's nothing there yet, right? But
yes. So right now, that website talks about before dentosophy, I'm a holistic biological dentist, which is also pretty cool. So I think this is integrating even more, just adding to my practice. I also, like you were mentioning, I'm trained in craniosacral. I don't advertise as that. I just work with patients as needed, and it's just adding to my practice.
Yeah, it's awesome. And really, if there are people that need dental work, you can look her up. No pressure there. But if you're ready to come to this retreat, jump on it quick because we're only limiting to 5 people in the beginning here. We want to make sure there's time to really be with people. Cool. All right. Well, with all that being said, Yoalli, yes, this is going out to the world. So I'm excited that you did not retire, and that you're ready to do what you got to do. All right. So you guys listening, sign up quick, sooner better than later. And if you have questions, you can always email us and we can chat a little more about that. But I got a feeling this one's going to fill up quick. All right. So good stuff, Yoalli. All right. Well, with that being said, I will end the recording. Dun, dun.